Good morning, everyone. Thank you all for coming to the 14th Orthodox Network Forum. My name is Tamara Kushnir Groman. I am a lawyer and senior life educator with CJE Senior Life, and I am a member of the Orthodox Network. Please note that today's program is being recorded and will be shared after the forum. For those of you interested in getting CEUs today, please listen for the special code word that will be required on the CEU form. We would like every participant to fill out an evaluation, so please look for the link in the chat towards the end of the program. We are so pleased to have participants from across the United States and Canada with us today. The Orthodox Network is a collaboration of social service providers in Jewish agencies who work in partnership to improve services to the Orthodox communities in metropolitan Chicago. The partner agencies co-sponsoring this forum are all listed on the flyer for today. A special thank you goes to the members of the Orthodox Network Forum Planning Committee. Eddie Loew, Jeffrey Blumenfeld, Nicole Druckman, Marilyn Siegel, and Rabbi David Rosenberg from JCFS Chicago, Esther Yona Friedman from Shalva, Rabbi Shlomo Crandall from Chai Lifeline, Dr. Miriam Miller from Nefesh Chicago, and Miriam Ament from No Shame on You. It is a pleasure and an honor to work with each of you. Thank you also to the team at JCFS who created the flyer for today's event, along with all those who work to ensure CEUs are available. Through my work, I have seen both the challenges we have all faced in the last 12 months due to COVID-19 and also the incredible innovation that has emerged. We know that there are many hurdles still ahead. Every group has their own challenges with managing COVID, vaccines, jobs, kids, parents, and all the other challenges that develop due to the pandemic. COVID-19 is no longer new, yet is continuing to plague, surprise, and challenge us personally and professionally. Today, our talented panel of speakers will address the lasting impacts of COVID-19 in the Orthodox Jewish communities. To give the utmost respect to our panelists and all those who join today, please take a minute to mute your microphones. Following their presentations, our panelists welcome questions. Please submit your questions through the chat box, and our moderator, Rabbi David Rosenberg, Orthodox Community Liaison from JCFS Chicago, will bring them to the panelists. It is now my pleasure to introduce Eddie Loew, Assistant Director of Adult, Child, and Family Services with JCFS Chicago, to introduce our speakers today.
Thank you, Tamara. Okay, so I'm going to be introducing all of the speakers, and then Dr. Katz will begin the presentation. So our first speaker is Dr. Ben-Zion Katz. He is an attending physician in infectious diseases at Lurie Children's Hospital and a professor of pediatrics at the Feinberg School of Medicine at Northwestern University. He received his degree in 1980 from the NYU School of Medicine, was a resident in the Department of Pediatrics at NYU. He's also done a postdoc in pediatric infectious diseases. He was an instructor in the Department of Pediatrics and Epidemiology and Public Health at Yale University. He was an assistant professor in that department as well. He's been an assistant professor of pediatrics at Northwestern University, then an associate professor, and now a professor at that university. Dr. Katz has been advising public, parochial, and private schools, shuls, and churches and senior living facilities since the outbreak of COVID-19 began. Welcome, Dr. Katz. Our second speaker is Rabbi Eli Samber, somebody who I have known for many, many, many years. Rabbi Samber is an Erie Crown graduate, the class of 1980, and has spent 9 years teaching at the Erie Crown Hebrew Day School. He was an 8th grade Rebbe all those years. And after that, he became the head of school, which is a position he has held for the last 17 years. Rabbi Samber attended Skokie Yeshiva here in Chicago, went to Baltimore to attend Yisroel, spent time in Israel, and also spent time learning in Passaic, New Jersey. He learned in the Kollel Lakewood East in Israel, and also spent 2 years learning at the Chicago Community Kollel. He has a BA in Talmudic Law and a Master's in Education Administration from Loyola University, and Smicha from Rabbi Daniel Lehrfield from Beis Yisrael in Israel. Welcome, Rabbi Samber. Fran Gutstein, who is our third speaker, is an LCSW with more than 30 years experience. She's also a Type 73 certified social worker. Fran is trained in EMDR, telemental health, as well as being an advanced trainer of the Nurtured Heart approach. She has worked for Shalva as a domestic abuse counselor and provides consultation and supervision to students, as well as other mental health professionals in the Chicago area. Fran maintains a private practice in Lincolnwood, Illinois, where she works with families, couples, adults, adolescents, and children in families and in groups. Welcome, Fran, to our seminar this morning. And to wrap things up, Rabbi Yaakov Robinson. Rabbi Robinson is a Chicago native, and after several years in Baltimore, his family joined the Community Kollel in 2006 in Cincinnati, where he was a member for 5 years. In Cincinnati, Rabbi Robinson was also the assistant rabbi of one of the congregations there and an active member of the Chevra Kadisha. Rabbi Robinson joined Congregation Mikor here in Chicago as co-rabbi in 2011. Since then, he has used his unique personality and leadership skills to help the congregation grow to where it is today. At Mikor Chaim, Rabbi Robinson learns one-on-one with many individuals and gives several weekly classes. And those classes include classes on peace in the home, raising children, and practical laws within the Jewish community. Rabbi Robinson has also founded and run a morning study group, and he gives regular classes to the women in his congregation. When he moved to Chicago, he was a Rebbe at Erie Crown Hebrew Day School for 3 years and has been the executive director of the Midwest Agudas Yisroel Council of Synagogue Rabbonim since 2013. In addition, he's on the Orthodox Rabbinic Task Force for Shalva and a member of the Vad HaChinuch for Joan Dax Beis Yaakov, Yeshiva Tiferet Tzvi. As of 2018, Rabbi Robinson also gives multiple lectures to the more adult college students at Hebrew Theological College. Rabbi Robinson is a sought-after speaker, and he has lectured in many shuls, schools, conventions, and other events nationally. In addition, he's the author of many works on Jewish law. Rabbi Robinson is known for his warm and caring personality and is often looked to by individuals, couples, families, and community institutions for his assistance, guidance, and counsel. Welcome, Rabbi Robinson. And I am now going to turn the microphone over to Dr. Ben-Zion Katz, who will be our first speaker.
Good morning. Thank you very much for the kind introduction. It's nice for the Orthodox Forum to have invited me and the other distinguished panelists this morning. First slide, please. So, actually, let's go to the next one, please. Great. So I've been asked this morning to describe the morbidity and mortality associated with COVID. Morbidity, of course, means like the complications from the disease, and mortality, of course, means, unfortunately, the people who die from it. I was also going to describe COVID mitigation strategies, as well as to begin to at least look at how the Jewish community and the Orthodox community were affected by this magefa, by this plague. Next slide, please. So just to start with a little bit of basics, there are a lot of coronaviruses, but about 7 are known to affect humans. There are many others that affect other vertebrate and other species. 4 coronaviruses cause mild illness, what we would call the common cold. 3 of them are more serious, and they've all emerged, if you will, in this century for reasons that are unclear. So SARS was the first one in the early 2000s, as you all know, had a very high mortality, but fortunately or unfortunately was only spread symptomatically. So there were a few 1,000 cases, few hundred deaths right away. They were able to isolate all the individuals and quarantine all the individuals who had it. And basically, it kind of died out. The second serious coronavirus infection to emerge this century was MERS, Middle East Respiratory Syndrome. It's not exactly clear where that one came from. That one is still, there are still cases of that, but as its name implies, it's really been restricted to the Middle East. I mean, really hasn't spread beyond the Middle East. It affects a relatively small number of people, but unfortunately also has a high mortality, just like SARS. The third one is the one we're involved with right now, and it's called SARS-CoV-2 because it's similar to the SARS virus that was earlier in this century, but unfortunately it has a lot of different characteristics. Next slide, please. So when all of this began, there was obviously a dearth of knowledge about this virus. So early on, everyone realized that COVID was less deadly than SARS, but more easily transmissible because it could be transmitted from those without symptoms. And in fact, as I'm sure you all know, probably at least 50 or 60% of individuals who are either asymptomatic, means they never will get symptoms from the disease, or pre-symptomatic, before they develop symptoms, can transmit COVID. So that's why it's been very, very hard to contain, or one of the reasons it's been very, very hard to contain. So far, there's been about the same number of deaths, or it's actually slightly more at this point, than the worst flu season on record since vaccination has been available. So since vaccines have been available, 1957-58 flu season was the worst season in terms of proportionate numbers of deaths. We've actually slightly exceeded that now with COVID. The mortality is also relatively high, and it's almost as high as was seen with the so-called Spanish flu that circulated a little over 100 years ago. And you all probably know this, but you know, Spanish flu had nothing to do with Spain. The Spanish flu arose during World War I, and all of the battling countries didn't want it to be known that they were shipping soldiers to area where there was the flu raging in Europe. So the only newspapers that talked about the flu 100 years ago were the Spanish newspapers, because it was neutral in World War I. So people called it the Spanish flu, but it's really a misnomer. Anyway, getting back to COVID, about 80% of cases are mild, 15% are severe enough to get into the hospital, and unfortunately, 5% of cases, people get critically ill, end up in the ICU, and a large chunk of those patients, unfortunately, can succumb to the illness. As everybody knows, mortality increases with age. When the illness first began, people talked about mortalities as high as 15% in those over 80, about 8% in those over 70, and 2 to 3% in those over 65, which is a club I've recently joined, which is why 65 and over is considered a risk group for this disease. There were also some pre-existing conditions that increased mortality, although some of them were not the ones that you would necessarily think of. So transplant recipients, for example, do not seem to be at that high a risk for complications from COVID. However, as you all know, things like hypertension, obesity are. The number of deaths is now decreasing in all categories, but the same risk factors are there. So the same differences in mortalities are still present, although thankfully all the numbers are much lower now because we have a lot more experience with the disease. We also have some better treatments. Again, as you all probably know, the average incubation period for COVID is 5 or 6 days. The earliest post-exposure infection transmission can begin as about 2 or 3 days after exposure, and a lot of people are still asymptomatic, which is again the problem of trying to contain this illness. About 97% or so of people become infected by day 12, 95, 97, and about 99% by day 14, which is why the original quarantine recommendations were for 14 days. Complications from the disease, if they develop, usually begin about 4 to 8 days after symptoms. So just because you feel okay in the beginning, unfortunately, is not necessarily all that reassuring. Now, there's one kind of technical number here. Epidemiologists talk about how many people you can infect, or how many people the average person infects when they get an illness that's contagious. So, and that's called the R number. And the R number for COVID seems to be about 2 or 3. And mathematical models tell us that when the R is 2 or 3, you need to have a herd immunity of about 50 or 60% to prevent epidemics. Herd immunity is similar to the concept of kindling, right? So if I throw a match down on a concrete floor, it's not going to cause a forest fire. But if I throw a match in a dry forest where there hasn't been rain for a couple of months, a forest fire can begin. So that's the concept of herd immunity. There really have to be enough susceptible people for an epidemic to propagate. Just to give you some comparison, measles is about the most contagious disease that we talk about, and measles has an R of about 18. Next slide, please. So early on in the epidemiology of COVID, there were some very scary stories, and this is why people took a lot of relatively drastic measures to try to prevent its spread. So there was some spread at family gatherings where you'd see a cluster of 16 cases leading to 3 deaths, associated with a single individual who attended a shared meal and a funeral within 24 hours, and then a birthday party with people in his family 3 days later. There was also a terrible case of a spread at choir or music practice, where the secondary attack rate was greater than 50%, 6% of people were hospitalized, and 4%, 2 of the people who attended this choir practice actually died. Now, they had chronic conditions, but they obviously would have not died had they not gotten COVID. So these were terrible early epidemiologic stories, which made people, again, very cautious in terms of what they were going to allow groups of people to do. Later data showed that a 6.5-foot distancing from people and cloth over the bell of an instrument would prevent spread. And these were things we looked at, for example, when we talked about blowing shofar over Rosh Hashanah this past fall. There was also a terrible case of spread at a large church where 38% of people became infected and 8% of people who attended that church service died. Again, these were mainly people over 65, but they wouldn't have died had they not gotten COVID. And again, all of these early data was seen in the Jewish community regarding sermons, seders, shofar blowing, and davening and singing in shuls. Next slide, please. So there was also a lot of data from hospital transmission, which people used to try to make some kind of recommendations that would make people safer. So early on, hospital transmission was very high, as you might imagine, because no one knew what was going on. And it was as high as about 35%. Now, it's close to 0 because everyone is masked and everyone, knows what to do to prevent the spread of COVID. From some of these early data, we learned that the average time spent by a healthcare worker with COVID, with a COVID patient who got infected, was about 120 minutes. So if you were 2 hours or more with a patient who had COVID, you had a very good chance of getting COVID. If you were 25 minutes or less with a patient with COVID, you were very unlikely to get COVID. So that's where some of these early guidelines came from limiting shul davening, to 25 or 30 minutes, to limiting contact to 15 minutes. That's where some of these data came from. Also, in mice engineered to get COVID, they needed 25 minutes of exposure in order to become infected. Obviously, in the laboratory, you can do things with animals that you can't do with people. And again, that's where we made these recommendations about no frills davening, etc. Overall, about 5% of contacts become infected. So COVID is not as contagious as measles, as I already mentioned, for example, or chickenpox. In a household setting, obviously with more intimate exposures, the contact spreading is higher. Most studies show that it's between 10 and 40%, although there was one study I saw where the in-household contact was as high as 80%, but it's probably more like 10 or 40%. Sharing a meal increases your chances of getting COVID. The risk goes up to about 7%. Eating in restaurants or coffee shops increases your risk of infection 2.5 to 4 times. And these were the kinds of data that led us to forbid kiddushin in shuls, unfortunately. Next slide, please. Now, there's several ways that an infection can be transmitted. I hinted at transmission a couple of times, but just to go through them quickly, most of COVID is transmitted by large droplets. So large droplets means the kinds of particles you would see come out of my mouth or my nose after I cough or sneeze, or even after I'm trying to project my voice, as I'm doing now, even though I'm just looking at a computer screen. Droplet nuclei are tiny little particles that float along with air currents. And that's what people talk about when they talk about airborne spread. This is probably not much of an issue with COVID, especially if the rooms and that we're talking about are well ventilated. So the question here is, can the tiny little droplets get carried along further than a few feet, and will they stay in the air after the person is out of the room who is contagious? So the answer is probably not with COVID. And then we know also that fomites and surfaces do not transmit COVID very much. The estimates now are less than 10%. And in the beginning, of course, you remember there were recommendations to wipe down your grocery bags and things like that. That's not really necessary based on what we know now. Next slide, please. So before there were any vaccines or any treatments, you had to have some kind of mitigation strategies. And these mitigation strategies go back at least 100 years, obviously more, but at least 100 years to the Spanish flu. And there was actually a fair amount of data from that terrible plague from 100 years ago. So 100 years ago, there was no like CDC. So basically every municipality in the United States did what they thought was best. So you basically had almost like an experiment. We had 58 different states, or it was 48 at the time, doing different things. Measures included closing schools, isolation, quarantine, restricting large gatherings. And when people looked back at the data 80 or 90 years later, in the early 2000s, it turned out that by and large, the earlier and the more of these mitigation strategies that were adopted, the better the places did. Didn't really matter which ones you did, as long as you did a bunch of them, as long as you did them early on. So distancing more than a meter, masks and eye protection, we learned from this and other experiments, will decrease transmission by around 80% each. So when you have 2 or 3 of them, your transmission decreases probably close to about 95%. Sunlight inactivates the virus. That's another reason, for example, why being outdoors is a good idea, although not on a day like this. Now, one little bit of good news about all of what we've been going through for the last year, there's essentially no influenza this year. And there's a lot of reasons for that, but one main reason, of course, that people are wearing masks and people are staying away from each other. Next slide, please. So, we've learned a lot more about the epidemiology over the last few months, and we've also tracked the disease. So in November, as you probably know, there was a significant uptick in the number of cases and a small uptick in the number of deaths, ICU admissions, and ventilator use. Thankfully, it wasn't proportional to the number of cases, but that made us scale back some of the more lenient recommendations we made over Rosh Hashanah Yom Kippur, such as allowing longer davening times, letting perhaps 50 people be on each side of the mechitza, as long as the room was a large room with a separate entrance for the men and the women, and for adequate social distancing with up to 100 people in a single large space. Again, those are the kinds of leniencies you can do when things are going well. You don't want to do those when things are not going well. Next slide, please. And of course, now, thank God, there are 2 licensed vaccines in the United States. There are more worldwide for those over 16 to 18 years of age. They're very, very similar. Both vaccines require 2 doses, and both give you about 95% protection a couple of weeks after the second dose. In most vaccine trials, people try to enroll basically young, healthy people because they don't want to see complications. In these vaccine trials, because they knew that because they knew that it was going to be older and some kind of compromised people who were going to need the vaccine the most, they actually went out of their way to enroll a lot of older people and a lot of people with the risk groups for COVID. So that's really an unbelievable job that they did in a very short period of time. And the vaccine turned out to work equally well in all age groups and even in high-risk individuals. As you all probably know, almost 10% of people get a fairly strong vaccine reaction especially after the second dose, and it can last a day or 2. I mean, I had a colleague who couldn't go to work one day because of his vaccine reaction. There's no effect on fertility. I don't know where this is coming from, and it's actually recommended for pregnant women even in the first trimester. There's no problem with nursing women taking this vaccine. there's not even a theoretical reason why these should be of concern. Next slide, please. So I think we'll be able to go back to normal, God willing, once the vaccine is widely distributed and or we reach herd immunity. We're not quite there yet, as we all know. Everyone's impatient. And again, just to conclude quickly, we have, again, relaxed some rules, at least at some of the places that I've been consulting, because the numbers are all getting better now. And because with Purim and Pesach coming up, we're going to want to have larger gatherings of people to some degree. So we've relaxed some of the rules. Some people are already vaccinated, and there may be some leniencies that we can do with those individuals as well. But, and God willing, soon we'll be done with all of this. I think that's my last slide. I'm happy to answer any questions during the forum for questions later on.
Hello, everybody, and I hope everybody is somewhere where you are warm and we're doing well. Well, listening to Dr. Katz, which I've had the privilege of absorbing his information and drinking from his wisdom over the course of this pandemic, and never ceases to amaze me how fortunate we are to have you, Dr. Katz. It also taught me a lesson about the speech to text, and I'm glad to see that our immortality rates are rising, which is amazing. Okay, so I will try to be careful to select words that will only come out appropriately on speech to text. Although I did appreciate Scholl being referred to as Schultz. Okay, lasting impacts. As a head of school, my focus is this year been really to a very large extent on COVID. And as everybody knows, when it comes to schools, there's multiple demographics. You have your parents, the families, you have the staff and the teachers, and you have, of course, the students. And while I could probably speak for 15 minutes about each of those demographics, about lasting impacts, I think that my role here today is really to focus on the students and to share with the people on this call this morning some of my impressions about what we might be facing as far as lasting impacts when it comes to students because of COVID. The good news is kids are really resilient. We have a lot of concerns going into the school year with all the restrictions and the masking and the social distancing and the kids having been out of in-school instruction. And Baruch Hashem, we were able to open our doors back in the fall, and Bli and Hara keep them open. And there was lots of concern of how the kids were going to function coming back, both academically, socially. And like I said, the really good news is that we discovered kids are incredible. They're resilient, and they really roll with the punches. That being said, there are definitely ripple effects of what's been going on and what continues to go on. Some of them I think are obvious. I'll list them, but they're not really. I don't think they'll be news to anybody here. There's a heightened anxiety that is detectable amongst the students, although I wouldn't say through the roof anxiety, but children that did struggle with anxiety before, we saw that show up with maybe a little bit of a greater intensity. I think it manifested itself more in school refusal. There are more cases of school refusal this year than I could recall in previous years. And part of that has to do with having been out of school for so long. Kids discovered that they're very happy at home, not coming to school. And so the option in their head is there when in the past the option wasn't there. And part of it is just having been away from school, the anxiety of coming back and the social pressures and all of that. So anxiety is there. There's definitely an uptick in attention challenges for the children. And we're seeing some more executive functioning issues. But I think that those are all things that they're obvious and today's topic being lasting impacts, I don't think any of them will be lasting. God willing, I think that they will. Those things will come back to the normal range. Not that we never have issues with executive functioning or anxiety or attention, but I think we'll see that come back to more normal numbers. I think some of the things which I'm more concerned about, and as opposed to Dr. Katz, who works much more in a world of data and concrete numbers. I don't have those concrete numbers, not yet. But here are the thoughts as to things that we might be seeing with our students as possible lasting impacts. Number one is the level of screen time that our kids have been allowed/forced to be involved with because of the remote distant learning, because of being home so long, because of parents being working from home and really needing that the babysitter for their kids and the scarcity of options for what kids used to be able to run out and play basketball at the JCC or whatever it may be. So we find that our kids are really having serious, I won't use the word addiction, that's a pretty strong term, but addiction-like thing, addiction-like relationship with their devices and with their screens. And we're hearing it's the ripple effect of what that is meaning now and down the road is certainly something that's of great concern. The next thing is that I would say is because there's so much of looking for, as we finish off the last slide from Dr. Katz, when are we getting back to normal? So there's a lot of looking down the road of when are we getting back to normal? When are we getting back to normal? The kids absorb that from their parents, from the teachers, from everybody. It's when will be in the future we'll be able to function like normal. And while that's understandable, but the ability to develop being present in the moment. So when you're sitting in a classroom or wherever that may be, to be able to take in what's happening right now without thinking about what will be and when will be, it's a skill. And it's something that we work on with kids. And I see that as being something that's going to need to be monitored as we move forward. The flip side, which is like the double whammy, is not a lot of faith in the future. So yes, there's the question of when we're going to be coming back to normal, but there's a lot of kids are absorbing a lot of this is the new normal. Life is never going to return back to the way it was before COVID. Those people that make the parallel to like life before 9/11 and life after 9/11, and it'll never be the same. And so kids, not so much the little kids, but the older kids, they're hearing a lot of this, and it's certainly it's messing with them. It's messing with their long-term and their vision and their confidence in the future, and almost creates with some kids a certain sense of, we don't know what the future is going to bring anyway, so then whatever, which is never a healthy thing. Some of the more maybe more nuanced, but it's for me something that I worry about for our kids, is that coming out of this pandemic, there has sadly been, to whatever level there was trust in authority prior to COVID, and that an adult is worthy of listening to, because adults generally know what they're talking about. At least that's what we want our kids to grow up thinking. And certainly people that wear uniforms and have official titles and lots of letters after their name should be somebody that you take seriously. That's been eroded. They receive a lot of bombardment through whether it's through the media, through your local neighborhood guy on a soapbox, or your friendly pontificator. They just hear a lot of the fact that nobody knows what they're talking about anyway. Not the medical world, not politicians, not your parents, not the school. And I shudder to think of what that means to a child growing up in a world where Okay, fine. As we grow up to be adults, we find out that that may all be more true than we'd like to believe. But there's a healthy way of growing up where you have confidence in the adult world that is raising you, and that's a concern. And perhaps even more concerning is within the Jewish community. Within our own what we try to strive for is that unified Agudas, that feeling in community that I'm sure Chicago is not unique to. I think has taken a little bit of a hit, as because just the different camps when it comes to thinking of how to deal with COVID. Are you a masker? Are you not a masker? Do you believe in vaccines? Don't you believe in vaccines? So even within the fiber of their own world, I've had children say to me, young kids, third graders, like, Rabbi Samber, why do you make us wear masks? Everybody knows it's a conspiracy. Okay, so when you're hearing that out of the mouth of an 8-year-old, what that means for a child growing up, and what that means for a community that strives to create that Agudas. So those are all the kind of concerns. Lasting impacts of COVID. Mr. Hashem, none of them will be lasting impacts, and we'll be able to come out having worked through these issues stronger than we ever were. And so maybe that will be our lasting impact, is that we'll be stronger than we ever were. But these are the issues that I think that we would be wise not to stick our head in the sand and address them with a lot of thought. And that's my presentation.
Thank you very much. I'd really like to honor the work of mental health professionals. These are really uncharted territories in these COVID times. As mental health professionals, we connect deeply with our clients, and these COVID times have really changed the way that we work. We've had to, I think the word is called pivot, and it's a very new way. And it's not, there was a snowstorm and all we had to do was turn on our computers. And I was thinking to myself, oh, this is so convenient. I'm almost getting used to it. But to have to sit in front of a computer and to have to deeply connect, this is hard work. It's not only hard work, it's heart work. And as I was putting together my presentation, I was thinking to myself, I feel like there's a piece missing. And this is the piece that was missing. Being able to talk to you about how sometimes to be able to get the gestalt, that real feeling of what is really going on, of what a client is really feeling and really experiencing. And I feel like Rabbi Samber spoke very deeply to that. What's often going on, what is happening in COVID are those experiences of trust, communication, respect. And that's interwoven. That's what's happening with families. That's what's happening with couples. That's what's happening with individuals. With altered routines, with financial pressures, with social isolation, people are understandably worrying about getting sick, how long the pandemic will last, whether or not they will lose their job, and what the future will bring. Thank God now that there's now that we're almost looking with the vaccines, we're seeing that there's, thank God, a brighter future ahead. I still want to speak to what I've seen in my practice because we're dealing with that. I want to talk to you about what I've seen in the past few months. Okay, so the Orthodox community is built on the fabric of relationships. Relationships are so core to the way the community works. And the COVID has disrupted that dance of relationship. For some families, they've chosen to keep their children home. They've chosen to not send their children to school, to homeschool them. Some families have had to do that because of health issues. Some families have chosen to do that because they're being careful around grandparents, whatever the issues are. And initially for these families, it seemed like a good idea. But then it's turned almost into a type of social isolation for these children. It's turned into a type of social anxiety for these children. For some of these kids, it's hard to get on Zoom. They don't want to be the odd man out. They feel uncomfortable having Zoom calls, phone calls. It's hard to engage. And for these children, as well as for other children, the stresses of Corona are larger. It can be the loss of a family member or a loved one. And anxiety and depression begin to build. Children with depression and anxiety, underlying in depression and anxiety, for children that have underlying depression and anxiety, the symptoms can worsen. Depression can be easy to miss, especially in teenagers, since adolescents are often moody. With everyone struggling, it can be hard to tell the difference between a child who's just feeling irritable or frustrated and a kid who's slipping into depression. A good way to know if it's here today, but gone tomorrow, then it's usually not a cause for concern. What's more of a concern is when it persists, when there are changes in sleep, mood, appetite, and general engagement. Rabbi Samber also spoke about families, about the increase in devices. What there really is also is a tremendous stress in families, because for many families, they've tried to almost, some of them have tried to limit the devices or almost keep their kids away from having devices. But now it's almost like the Pandora's box is opened, and there's this watershed of stress and pressure. And now their kids have this new knowing, and power struggles abound. I have young clients who are college students and post-college students who are at home. They were planning on living on campus or living on their own until in their own apartments until Corona determined otherwise. And some of my clients feel like they're trapped in their parents' homes. Now that's very understandable, but for some of these clients, there are other issues. They're in a different place religiously than their parents. And when these clients come home for a short period of time, they're able to abide by their parents' religious standards. But when they're there for a long period of time, it becomes more and more difficult. And depending on the family dynamic, this can become incredibly stressful, and it really depends on how this gets played out. And this has been extremely difficult for some families and some of the young clients who feel like, I can't do this anymore. I believe that also, I'm not sure if Rabbi Katz spoke about this or Rabbi Samber. I think Rabbi Samber also spoke about this. Who's wearing a mask and who's not wearing a mask, who can be trusted and who cannot be trusted. There are these tremendous experiences of who can I trust, who can I not trust. There are some people who have chosen to be careful and who've chosen not to be careful. So it creates this feeling of who can I hang out with, who can I not hang out with. That increases feelings of stress and pressure. I'd like to also address some populations that can almost be overlooked. I'm privileged to work with an organization called In Shifra's Arms, and it works with women who have unplanned pregnancies. And this is an experience that happens when there's not Corona. This is even heightened during Corona. I'm talking about unplanned pregnancies for married women and for unmarried women. The isolation, first of all, for in married situations, the difficulty financially, socially, feeling like there's not support, and even more so for unmarried women. So I want to mention the organization In Shifra's Arms, and I want to talk about the incredible need for support for women, especially during the times of Corona. I don't know how much more time I have. I'm noticing we have another speaker, but I also want to talk about the elderly. During the time of Corona, that's also, there's a tremendous feeling of isolation. Isolation leads to loneliness. Loneliness leads to depression. For many, elderly connection with family prior to COVID was a key part of their life, especially in the fabric of Orthodox life. The ability to hold grandchildren, be it at the homes of children and grandchildren for Shabbos and holidays. Not all families have resources for caregivers. Some elderly are on their own. They don't have technology to be connecting via Zoom and WhatsApp. It's very isolating and lonely. For the elderly, they're missing the connect. The isolation increases confusion, depression, anxiety, and loss. For the elderly, during this time, there's an increase in medical issues, an increase in dementia, not enough socialization. They're not able to go to synagogue. They're not going to classes. There's the possibility of elder abuse from caregivers and even family members. And due to the isolation, who would know about this level of potential elder abuse? Finally, I'd like to address domestic violence. Unfortunately, domestic violence happens. Domestic violence happening around COVID is much more concerning. Domestic abuse is about power and control. With domestic violence, there's a pattern to it. It doesn't just happen. It usually occurs at the beginning of the marriage, perhaps after the first pregnancy. There's a pattern. It's on again and off again. During COVID, men use it as a tool to further the abuse, to further the power and control. It's about what men gain from the virus. For example, a divorced man might refuse to return his children to their mother saying, "Mommy's sick with COVID." There are some men who are controlling every woman's move because the woman isn't working and both of them are home. Some women are so isolated they can't see their families. There are some women who have left their abusers and now, due to the financial concerns, they have to return back to their husband. The financial constraints of COVID have created a tremendous issue with housing for women who are trying to leave during these times of COVID. The weather is not helping at all. Some other examples of difficulties during COVID, men might even be hiding the hand sanitizer. A really big concern is no one is seeing, well, until the kids were back in school, people weren't seeing the children in person. And that's really an issue. Or even if children are being held at home, perhaps the abuser is keeping the kids home. This is really a concern. The bottom line is each and every one of you, that is the healing for each individual that you meet throughout this entire process is connection. Through this experience, through these unprecedented times, whatever any of you can do is through a kind, open, judgmental, and hopeful heart. These are difficult times, and we each have to be open to what we can do through connecting and allowing ourselves to be open. And with God's will, we'll get through this together. Okay, thank you.
Okay, good morning, everyone. Thank you, Eddie, for the kind introduction before. Thank you for the opportunity to speak today on this very important topic to a group of very important people who are the frontline workers to help a lot of people that are very much in need over this past year. I want to thank everyone for joining this morning and for your hard work to make the world a better place. And it's certainly my honor to be able to speak together with this panel today. All the presentations were really right on target and very meaningful for me. I was taking a lot of notes here, so thank you for including me. So I'm the fourth presenter this morning, and you already have a bit of a bleak and clear picture of the devastating impact of COVID-19 on the world and on the Orthodox Jewish community. That being said, I was asked to give the rabbinic perspective, and hopefully I'll manage to share some new perspectives that will help you better serve your clients over the next few months moving into the future. You've heard about the physical and medical impact of COVID-19, You've heard about the emotional and mental impact of COVID-19. You've heard about the educational and developmental impact of COVID-19. And as mentioned briefly by Dr. Gutstein, you've also heard about the financial impact, which is really an area that I really could give an entire presentation about, and the anxiety and stress that's caused by those people that have lost their jobs or lost the level of income they had in the past is something very serious, and a lot of fundraising has to be done to be able to assist those families to hopefully bridge them over until better times. I'm very close with a person by the name of Tzvi Gluck. Tzvi Gluck runs an organization in New York called Amudim. Amudim is an organization that deals with the full spectrum of mental health issues. And I called him yesterday just to get some data. As mentioned before by Dr. Katz, sometimes data and statistics do show clearly some of the impact. And he gave me the following scary numbers of just their workload in their one organization. And they have hundreds and hundreds of cases a year. The anxiety levels this past year went up 162%. The depression levels this year went up 80.8%. Domestic abuse is 45.2%. Suicidal ideation went up 53.7%. The need for housing placement for women, a topic that was just spoken about as well when it comes to domestic abuse. Not all of these women mention the reason why is domestic abuse, but they know very well if she's asking for assistance moving out of the house, very likely that's what's happening. The housing placement went up 68%, and sex addiction went up over 80% with their caseload. So again, these are just very clear statistics that this was a very difficult year. And I share the optimism that Rabbi Samber had that hopefully this is not a lasting impact. Hopefully this is short term, but these are definitely very scary statistics. All these topics, a rabbi in his position does have access and a view into that world, because very often we are the first responders. I refer out to the mental health professionals, and I do refer and ask for advice from doctors and from the principals of the schools, but very often we are the first responders to these issues, and I can certainly validate everything that's been said by the first three presenters today, that everything they've been saying is really right on the mark and fully accurate. But for my few minutes I have this morning, I just want to focus a little bit on the spiritual and religious impact of COVID-19 on the community. Even if you're not personally religious or observant, I've come to learn over life that the definition of emergency is the urgent need of the person sitting across the table from you, sitting across the Zoom from you, sitting across the phone from you. And there are many of your clients that are going through spiritual and religious trauma, and you need to understand and validate and know where they're coming from when it comes to this trauma. I am by nature a very positive person, and therefore I like to start with a couple of positive notes, and then I'll share with you some of the negative things I've been seeing in the community. One story, a short story that I've been sharing very often over the last year, is that right after Pesach last year, I officiated at a wedding. It was a 10-person wedding because that was all that was allowed. We allowed the groom not to wear a mask, but I was wearing a mask sitting right next to him. And the photographer came over and said, "Smile." And we kind of leaned in towards each other, and I gave a big smile. And I realized afterwards that it seemed kind of foolish to be smiling so wide behind a mask. But I came to realize the following idea. In Jewish thought, history is divided into two portions. There are portions of history that are known as the revealed face of God, where you sense the presence of God in this world. And there are other periods in history known in Hebrew as Hester Panim, is that God's face is hidden and you don't sense his presence. And many say that the era we're going through right now is certainly considered to be one of those eras in history that is Hester Panim, the hidden face of God in this world. We don't sense his presence. But I came to learn that just like I was smiling behind that mask, God can be smiling behind his mask as well. And I've come to see not only the negative underbelly of what's going on in the world, but a lot of positive. The amount of chesed and kindness and generosity that's being done, the hard work of the frontline workers, the hard work of the mental health professionals, the hard work of the schools to stay open and to provide quality education. And it really is a very beautiful thing, and to appreciate that God is smiling down upon us, for all our hard work. Additionally, we're about to reach the 1-year anniversary of when this all started in the United States. I remember in Chicago, the first communal meeting that we had to discuss COVID was 5 days before Purim last year. Purim is this coming Friday. The first letter that was put out to the community jointly by the Agudas and by the CRC was on March 9th last year, which again, if you follow the Hebrew calendar, is about the same date that we have right now. And it's important to get a perspective a year into this, what are we supposed to learn from this? And we truly and sincerely believe in a concept in Hebrew called hashkafa pratit, which means divine providence, that God does things for a reason. And although we don't know, and we're not prophets to know exactly why what is happening, we do know it's to teach us a lesson. And there are lessons that we need to learn from all this. And instead of just focusing on the negative impact, to try to stop and to focus on. A lot of my lectures and classes recently is try to pull out 10 positive things that we may have gained from this year, to say to God and to understand for ourselves that we've learned important life lessons and became stronger in certain ways over this past year. Just for example, I have a congregant of mine that went through a certain trauma and that forced him into therapy. And he's thankful that he went through that trauma, forcing him into therapy, to force him to work through and to dig deep into his closet and to unpack a lot of the baggage that he has from his youth. And now he's a very strong person. He's very thankful for the trauma that he went through, because now he's stronger because of it. And I think in terms of our appreciation of how God runs the world, and it's not us, our appreciation of our lives are limited, and we have to try to make the most of the situation. There are many, many people that came out stronger in their faith and stronger in their commitment to be contributors to this world to make a better place. And those are some of the positives that I have seen. And like Rabbi Samber said before, and I fully agree, hopefully that will be the lasting impact. The lasting impact will hopefully not be the negative impact. Hopefully we'll be able to weather that storm and be resilient and bounce back. But the positive impact should be the life lessons that we've learned from this experience. That all being said, I know that I was not invited to share only the positive. I was invited to share some of the negative. So as I present to you some of the negative that I've seen, I'd like to put it into perspective. We're all familiar that the Jewish Sabbath, Shabbos, is something that observant Jews keep and all Jews keep with great personal sacrifice. They keep all the laws. This includes use of any technology, cars, phones, computers, etc., from sundown Friday night until nightfall Saturday night. We know that in the early 1900s, there were many men and women that every single Monday had to get a new job because they refused to go into work on Saturday. They got fired, and every single Monday they had to go searching for a new job. The only thing that overrides the observance of Shabbos is danger to life. And therefore, we could often use Shabbos as a litmus test to see how serious the situation really is. And is it considered to be a danger? And if it's a danger, then it overrides Shabbos. So what is considered to be a danger to life? First of all, physical danger is the most obvious one. In March and April, my phone was on every single Shabbos and every single day of Yom Tov, just in case I got any urgent phone calls, to be able to take those phone calls, because we know back then I was afraid to see what I was going to see over Shabbos and over during the week. There was physical danger, and that was certainly an override to go to the hospital, to make phone calls, to contact your doctors. I personally remember 2.5 years ago when my father passed away on the second day of Rosh Hashanah. It was midnight on the second day of Rosh Hashanah, and I had a serious medical question to ask. And I called Rabbi Shmuel first, dying of Agudas Yisroel. And at midnight on Rosh Hashanah, Rabbi first picked up his phone. He saw my name and caller ID, and he picked it up because physical life is an override for Shabbos. What's not as well known is that emotional health and mental needs can be an override for Shabbos as well. This can't be given as the blanket leniency, but if there are cases of extreme trauma, of extreme anxiety, then yes, one can make a phone call. One can make sure to contact those who are able to help them under the circumstances. This Amudim organization I mentioned before, they put out 2 monumental videos right before Pesach last year by 2 of the greatest halachic, Jewish law authorities on the East Coast, making very clear statements. If anyone is isolated and alone over the holiday of Pesach, and they feel they need to make a phone call, they feel they need to go to their AA meeting, they feel they need to get help in any way, and it's feeling there's a sense of any danger whatsoever, any doubt of danger, pick up the phone and make that phone call. And that really was a turning point in the eyes of the Jewish and the Orthodox community, that mental and emotional needs are very, very serious. Like I mentioned before, my phone was on. There were many people for the holiday of Pesach and other holidays and other Shabbos after that I told them, my phone is on, the ringer is on, I left it in a central place in my home. If there's anything that you need, please give me a call. I will pick up the phone if you do call me, because emotional needs can, in certain cases, be an override for Shabbos. What's not well known, and thank God doesn't often happen, but spiritual needs sometimes could be an override for Shabbos. We know that humans are made both of body and soul, and we need to maintain the health of both of them, the spiritual need of both of them. And one's soul is eternal, and therefore people really need to preserve it to the best of their abilities. Just like we eat 3 meals a day, we try to pray 3 times a day to feed that soul. So with that in mind, I'd like to share with you a very short story. During World War II, there was a well-known kinder transport where there were young children that were saved from Jewish homes, separated from their families, but to save their lives, were sent across Europe to go into England to be able to bring them to safety. At the time, the chief rabbi of England, his name is Rabbi Abramsky, he was very concerned that they would be put into homes that did not share the same traditions and heritage of the homes that they came from. And he wanted to save their ability to maintain their observance that they had in the homes they were raised in. And he went around fundraising for this matter. He came into the home of a very wealthy individual. The person himself was not observant. And Rabbi Abramsky says, please dedicate and donate money very generously. This is a matter of life and death. This is a matter of life and death. So the person was a bit cynical and he said, really, this is a matter of life and death? I know by you, it's not really a matter of life and death unless you're willing to break the Sabbath because of it. And I really think you're exaggerating to call this a matter of life and death. They're safe and they're healthy. They're going to good homes. Why are you calling this a matter of life and death? So Rabbi Abramsky left. That Saturday morning, this individual receives a phone call. The phone's ringing. He picks up the phone, puts it to his ear, and he says to the person, hello, this is Katz Abramsky. I told you it's a matter of life and death. Now that's an extreme case, but just to understand the need of preserving the spirit and the religious observance of an individual for those who it's very important to them. So to tell you that the spiritual damage on the community has been catastrophic. There's a phrase in Hebrew, ein bayis she'ein bo meis, which basically means there's been no home that's not been spared, that has been spared, completely, some fatality or some damage to the spirit or the religious level of the home. I read an article in the New York Times that the church is suffering from the same exact thing. They're finding even the churches that opened up again, their pews are empty, the youth are not coming back. And we are sensing that right now. Again, we're hoping for the rebound, but we are sensing the same thing right now in our community. I know firsthand, everything I'm sharing with you now is firsthand, it's not secondhand information. There's a boy that was learning in the top yeshiva on the East Coast, the star student of that yeshiva, today is in a yeshiva in Chicago, who's no longer observing Shabbos, who is on drugs, involved in pornography, and the worst of all things. But this is one of what I have heard from the heads of many yeshivas in the country of dozens, if not hundreds of cases that have completely abandoned their faith, have taken off their kippas and yarmulkes, have gotten involved in types of behavior that are very unacceptable. I was personally on a call with a group of rabbis called the Moetzes Gedolei HaTorah, and one of the rabbis was literally crying tears of the amount of students that he's been losing who are no longer coming back, who are not attending classes, or are not going to pray into shul, and so many other examples that he had. My brother is a teacher in a yeshiva on the East Coast. He said that during the pandemic, best case scenario, the boys are watching Netflix the entire day. And that's best case scenario. Now, worst case scenario, unfortunately, is much worse than that. And now with the synagogues open, we see it firsthand that many people have not come back. They're not coming back for the prayers. They're not coming back for the learning. They're not coming back for the other religious opportunities that are available to them. And it's something that's very serious. One major topic that's been sidelined and ignored completely this past year is the topic of marijuana and recreational drug use. Last January, when it became legalized in Illinois, the rabbis band together and they put out notices and letters to the community. They were planning to have educational seminars to the community to teach them about non-use or acceptable and responsible usage of marijuana, but that got sidelined because other things happened since this past February and March that took our attention a little bit. But you can only imagine, I know firsthand of way too many kids and way too many adults that are using this at levels that are not acceptable. And again, that does impact not only their personal lives, but also impacts their religious life and their commitment to Torah and mitzvahs. So this is all reason why there was a major push to open the shuls as quickly, but as safely as possible. To open the schools as quickly, but as safely as possible. Because the needs spiritually as well, which are so crucial to the Orthodox community, had to be attended to. And again, to find that healthy balance, just like the essential needs of going to the grocery store had to happen, so too the essential needs of going to synagogue and going to school at all costs had to go on and had to happen as long as it's being done in a safe way. So if you have a client, that client may be struggling spiritually, religiously. You may have a client who their children are struggling religiously. Unfortunately, not a single week goes by without one or two calls from congregants of mine discussing the needs of their children and them sensing that they're not going in the direction they want them to go to. This is certainly a very, very serious matter. So to end off, I am optimistic. People are resilient by nature, and we're a resilient nation for sure. This morning, I already got a very promising note. There are 3 feet of snow drifts that all the schools in the Orthodox community have been closed. But in my own synagogue, we have 3 services every single morning, 6:30, 7:45, and 9 o'clock. And we had probably about 75 people that walked, including many Rabbi Samber students. To give him credit, my constituents all go to Ari Crown. And many, many young boys trekked through 3 feet of snow to be able to come to shul. And again, that's just part of the promising future that we have, that we will bounce back from all this. But again, unfortunately, right now, I am seeing a lot of spiritual, religious damage that needs to be tended to. So may we all merit, God willing, to see an end of this pandemic and to see the full emotional, physical, financial, and spiritual recovery for ourselves and for the entire world. Thank you for the opportunity.
Thank you, Robert Robinson. Thank you to Dr. Katz, to Rabbi Samber, to Mrs. Gutstein and Rabbi Robinson for your perspectives, insight into the experiences in the Orthodox community and considerations about lasting impacts and moving forward as we have greater health and more people are vaccinated and so forth. You've shared both information about the problems that are experienced by Orthodox individuals, families, schools, synagogues, homes and communities, and also you've shared a lot of positive and uplifting and inspiring thoughts about moving forward and about resilience. Some questions have been shared already in the chat, and I'd like to start with the question, a general question, and be as specific as you would like. And this is to all of our panelists. How can mental health professionals help with the challenges that each of you has identified? We have on the call somewhere in the order of 65 or so mental health professionals. What suggestions do you have? And perhaps we can answer this in the order in which you spoke. So Dr. Katz, if you'd like to start.
Yes, that's a great question. As many of the speakers so eloquently described, this has been a very trying time mentally. And just from my own perspective and for the perspective of epidemiologists, making recommendations for the community, believe it or not, it has not gone unnoticed that the impact that some of this social distancing and all this other stuff has on mental health, and how the mental health has to be taken into consideration when you're making these recommendations to try to keep people healthy. So I think that mental health is extremely important. I think that, the stigma related to mental health, hopefully is something that we all need to combat. If somebody, God forbid, gets a mental health problem, it's as bad as if they get cancer. I mean, people, these are terrible illnesses. Your brain controls your entire body. And people really need to be able to deal with it. So I think, whatever you're trained to do, you should do it. And you need to be extremely aware that these are very trying times, for little children, the extremes of age. I'm a pediatrician, but the extremes of age are very similar. So older people who are in, assisted living facilities, as well as little children who are in kindergarten age and below, this is extremely affecting them. And again, whatever expertise you have, and one good thing about this is that a lot of this can be done by telehealth, so you don't have to see people in person, which is great. I think I'll stop rambling now, but those are just kind of my basic thoughts and the perceptions about all of this and how extremely important it is.
Thank you.
Okay, so what can the mental health professionals do on some of these issues? And I just want to also address what someone sent me, put up on a chat regarding the lasting impact of the inevitable lasting impact that we're all going to have from having gone through this. And I just want to say that I do think that, of course, there's going to be a lasting impact. There's no way anybody is going through what we're going through. God willing, it will be one in which we could really take the challenges and come out stronger from it. But there's always going to be those challenges, that the scars of having gone through this. Okay, so what are some of the things? I'm not, I'm going to say these are just the ideas. One is when it comes to the idea of this feeling of lack of control that we're all struggling with, and that kids are like feeling that the world's just quote unquote out of control. I think that what we can do is to, number one, keep things as regular and as predictable as possible. One of the things that we're doing in school is we're really trying, we have an upcoming, every year we have a Purim carnival. And we could have easily said, we're just not going to have it this year, because why jump through hoops to be able to keep all the COVID regulations and guidelines. And how good could it be in the end anyway, if we're going to have all these things in place? And the answer is, first of all, God willing, it'll be great, different, but great. But those are the things that we can't overlook for our children. The things that they've come to see in life as being regular or normal. We just had a situation this morning at school with decision of, okay, I think that educators across the country, especially if you're living in areas where there's a lot of snow, so now have we done away with the snow day? So I had we canceled school, and there were quite a number of inquiries from parents like, okay, cancel school, but there's no reason not to have remote distant learning. And that's a supercharged question that I'm not putting out there, but one of the reasons why we, at least for a one-day snow day, is we want kids to be able to have normal. A snow day is something I look back at my childhood, and if I had to list my top 5 memories of all time, okay, after a Bears Super Bowl, there was definitely a snow day, and the last day of school. It doesn't get better than that. So to take that away from a child during these times, and that plays out, I think that as mental health professionals working with kids, help them be in touch with the regular things that go on in their lives, which bring them back to being grounded, as life is not really as out of control as some might think. I've asked the teachers at RE Crown to work on with the kids some sort of an activity that keeps them in the present. Have them, even an assignment that says, look at your fingers for today and tell me something about your hand that you've never noticed before. Just to keep them focused and present. So I think that's a big thing. That's not a small thing. I think that's over time. But if I were to suggest what would be the number one thing, is normal, predictable things, and help our kids be as much in the present and not thinking about what's 2 weeks down the road or a year down the road or 6 years down the road. I would say that would be my recommendation.
Thank you. Mrs. Gutstein or Rabbi Robinson?
So I would say that for mental health professionals, first and foremost, it's the non-judgmental, compassionate support that models the opportunity to rebuild trust. I also think it's really important to give opportunities to make referrals. If there's an opportunity for a referral, I presented two in my presentation. I mentioned In Schiffer's Arms, I mentioned Shalva. For the elderly, there's Chicago Mitzvah Campaign. They're doing tremendous work for isolated elderly. Think about support groups. For people, there's an increase in addictions right now. It's really important for people to get connected, for people to know that they're not alone. So I think that those are really, I would recommend that and suggest that. Okay.
Thank you.
I just have a couple of points I guess come to mind. I mean, the main thing you've already gained in terms of my presentation is just the awareness of this spiritual/religious trauma. When you're doing your diagnostic initial meeting with some of your clients, you talk about the emotional trauma they may be having. You may not factor in the spiritual elements. I just think the knowledge itself would be very helpful to you. The second thing I have, which either could be you're doing it already, or it's not so simple because of the importance of maintaining proper boundaries with your clients, is being proactive and actually reaching out to your clients without waiting for them to call you. I know as a rabbi, those are the phone calls that are most appreciated by my congregants and those who I know are lonely or isolated, or even have a house full of kids, but are just going through a lot of stress and difficulty, and just giving them a phone call and encouraging them and speaking through some of their issues is very helpful. If you know of any of your particular clients that you know are going through difficulty, or if you sense from your past history with them, and they may not be willing to call you, they may not want to bother you, but just reaching out and saying, hey, how are you doing? I think that'd be very helpful. But again, that's from my perspective. I don't know if that's always possible for you to do.
Thank you. A question for Dr. Katz, and then there have been a number of questions that I'll group together. First of all, are kids with ulcerative colitis or Crohn's disease or diabetes at higher risk from COVID-19? Dr. Katz?
Yeah, I'm sorry, I'm here. Okay, I was expecting to see my face when I was talking. I wasn't sure if I was able to talk yet. Okay, anyway, yeah, so that's a great question. So those are not exactly the same kinds of diseases, right? So ulcerative colitis and Crohn's disease are a little bit more in the way of inflammatory conditions. And inflammatory conditions don't seem to be that big a risk for severe COVID. Diabetes, I don't think it's been well studied in pediatrics, to be honest with you, or even in adults. But, you know, what I was trying to say before is that some of the traditional immunosuppressive conditions we think about, like HIV infections, transplant recipients, those patients are not that much higher risk, if at any higher risk, than people in their same age and other health categories, if you take out those kinds of severe immunosuppressive conditions. So again, I'm not sure how well it's been well studied with diabetes, but my sense is that we're not seeing a ton of diabetics in the hospital with severe COVID. We're not seeing a ton of kids with ulcerative colitis and inflammatory bowel disease in the hospital. We're not seeing a ton of transplant recipients or HIV infected patients. And on the adult side of the street, I think it's pretty much the same as well.
Thank you. There have been a few questions about new strains of the virus and how efficacious vaccines are.
Yeah, so everybody is, of course, worried about this. And without, I also tend to be optimistic, like some of the other distinguished members of this panel. And, you know, without getting too cynical about this, you know, newspapers and blogs, they're there to kind of engage you and make you nervous. And you're not going to click if you think everything is going well, right? So they kind of want to also always amplify some kinds of dangers. So the fact is, it's not clear, at least to me, based on published research, how much more serious some of these variants are. They're clearly more transmissible. Whether they're more serious or not, I know there's been papers in the lay press that talk about that they're actually more serious. But when you look at some of the data a little bit more carefully, it's not clear how well they've controlled for other things when they report these numbers. So I'm waiting to see somewhat more reasoned analysis. And it's tricky because everyone wants answers right away, but it takes a while to get good data, unfortunately. So it's not clear to me that the new variants are more serious. It's also not clear to me how much these new variants are at risk for people getting COVID a second time. I think there are rare cases of people getting COVID more than once, but the same thing is true of chickenpox. That doesn't mean that the vaccine doesn't help. And so it's not clear to me how much of a risk these new strains are for reinfection, or how much of a risk they are for the vaccine not working quite as well against them as as the more standard strains. I think it's going to take a little time to figure this out. I think in Israel, for example, where a lot of the population has already had at least one vaccine, and there's a lot of this English strain floating around, I think they're doing quite well against it. But again, you need to be cautious, you need to wait for good data. And that's why we haven't been relaxing too many of these very burdensome recommendations, such as masks and social distancing, because we really want people to be careful till more people are vaccinated, until we're sure that these other strains are going to be more controllable. Remember, even if they are a little more serious or a little bit more contagious, as long as many, many people are vaccinated and you have enough immunity, it may not be that much of an issue.
Thank you. And one related question, which I guess you've already really touched on, is the, at least implicitly, is the impact on children of the new strains. But it sounds like
yeah. So children have been a little bit of a mystery. This whole, have been a little bit of a mystery this whole pandemic. So when this disease first came around, like last Purim time, everybody was analogizing with the flu. And we know that, for example, children are super spreaders of the flu. If you close schools, outbreaks will go away. That does not seem to be the case with this disease. Children don't get it that much. Children don't seem to transmit it as much. And it's not exactly clear why, but the fact is children have been an interesting group to kind of study here and to kind of look at. And again, so it's hard to know what these new strains, what effect the new strains, might have on children as well. But children 2 to 19, and especially under like 12 or 15, really seem to not get this disease too seriously. They sometimes get this MIS-C complication, which we're seeing now, but that's still relatively rare. It's like in the order of 1 in 2,000 children gets MIS-C. So again, it's a little hard to know, but I would be cautious and I would move slowly about all of this, but I wouldn't be too concerned that we're not going to make any headway at all because of these newer developments.
Thank you. And I remember you mentioned in your presentation in the PowerPoint slides that for people who are getting vaccinated, after the second vaccine, within a week or two, they would have the whatever rate of protection, 95% or whatever it may be, depending on the vaccine. Thank you. So there are many questions coming in, and I'm going to go to other of our panelists today. So a question for Rabbi Samber. So children and families have been dealing with uncertainty about whether their pod or their classroom would be in session or whether there would be in-person school tomorrow or not. Is that something that you've noticed, Rabbi Samber? Has that affected you, or classes going on quarantine? How's that? What's the experience that you've noticed?
I apologize, Rabbi. If you could just repeat the question, I'm not sure I understood it.
Sure. So there have been families with children who have had uncertainty as to whether their particular classroom or their pod would be in person tomorrow or be on quarantine, and how has that impacted the kids and the school setting?
Okay, so just from my own personal experience at RE Crown, we really have thankfully, we have not had to been in a situation where I think children are going home one day not knowing what the next day will bring. For the most part, we've had our share of classes that needed to be quarantined, and certainly some of those calls came as the kids were on their way to school, or even after they arrived, happened to be shortly after that sent home. But for the most part, it's really not been the case, and I have not felt that there's a sense of trepidation or what's tomorrow, or kids leaving school saying, the way that you would see that are the children would be going to their teachers every day saying, should we bring home our textbook or shouldn't we bring home our textbook? Are we going to be on? I'm not seeing that at all.
Thank you. One more question, Rabbi Samber. Have you seen academic regression or setbacks, and what kind of things are useful for addressing that for kids? And your experience and the experience of fellow educators
Yes. So yeah, on that point, we definitely we speak with together. There's lots of principals that are going through this together and talking about. I think overall, what we've found is that there is some gaps in the skills that we did a lot of assessments at the beginning of the school year and then again in the middle of the year. And one of the things that we wanted to do was not push too hard on the gas pedal this school year and to ease the kids back in. So teachers have been needing to juggle between the annual stress of trying to cover curriculum, but also wanting to make sure that the children are getting the skills that they need so that they're able to move on to the next school year without any gaping holes. The kids have caught up a lot since the beginning of the school year. They didn't come in as weak as we were afraid. Some of them came in stronger than ever because the learning at home worked out really well for them. And parents were really providing for a lot of the children. I'm not just speaking for RE Crown, I've heard this from a lot of principals, that opportunity of learning without distraction, the normal distraction that goes on in school. Some of our kids came in really ahead of the game. But there were children that were weak, and there were children that were missing skills. And so schools around the country have brought as much as they can resource-wise to address the children. COVID has made that challenging because the limitations of the numbers of children that a resource teacher can work with at any given time within a small enclosed place, which is where most schools have their resource teachers working in smaller rooms with, now you can't put as many children into that room and you need the social distancing. So there's been many, many curveballs thrown at the schools to try to make that work. But I think we're in good shape. I really think we're in good shape when it comes to the academics level of where the children are.
Thank you. For Mrs. Gutstein, could you please speak to transference and countertransference in working with clients when the therapist is having some of the same experiences of COVID as the client, and there's automatic self-disclosure, and how this impacts the therapeutic relationship and the effectiveness of therapy? There's a lot there.
Absolutely. I first want to address something that was brought to my attention, an oversight on my part. I did not mention the Council for Jewish Elderly as a referral for the elderly. I apologize for that. It's such an important and powerful and necessary referral. So thank you for that. In terms of transference and countertransference, I would actually like to be so bold to say that I would like to see it rather when we are in the same situation, especially now with the situation with COVID. I don't see it as transference and countertransference. I see the experience as tremendous presence. It's almost like I see you. Your experience is my experience. I feel this. It's not like we need to be in this situation going, oh, it's not that. We can feel the pain so deeply because we are so present with them. And it's so necessary because very often what's happening is teletherapy. And if you're seeing your clients in person and you have a mask in front of your face and in front of their face, you're communicating in a different way. You're looking at their eyes. And like I said before, it's hard work and it's heart work. So having that presence is really important, being able to feel on a much deeper level.
Thank you. Rabbi Robinson, one question was raised about the experience of Shabbos, of the Sabbath. As fewer people are present in shul and synagogue on Shabbos, and Shabbos can be an isolating experience for those who are at home. Any thoughts about how to help families reconnect with Shabbos, reconnect with the joy of the Sabbath?
It's honestly a very good question, a very serious question. I was talking to some women of the shul. I was giving a Zoom lecture to them this week. They were mentioning that this coming Shabbos is going to be the first Shabbos in shul in an entire year. This coming Shabbos is Parsha Zachar, which is a special Torah reading that women tend to come to. Right on the heels of that is Purim. And, that has been very difficult for them who regularly come for services, regularly come for lectures, regularly come for Kiddush, and they haven't been here whatsoever. And we've tried different options. One of them is to at least infuse religious and spiritual meaning into the rest of the week, but that's not a replacement of making Shabbos a meaningful experience. I'm looking back at last Pesach, for example, and the amount of families that said that even though they were alone, even though they didn't have any guests, they didn't have the extended family, it was the best Pesach they ever had, because they invested so much energy in terms of ensuring they have a meaningful meal, they have meaningful insights on the Haggadah, and it turned out to be a tremendous success. But that being said, that was 1 month into the pandemic, and it's hard to maintain stamina for an entire year to invest so much into every single Shabbos and every single meal that you're going to have over that Shabbos. So it's definitely not possible to completely address this issue, but there are different things you could do to make at least have sparks of excitement and sparks of meaning throughout Shabbos to make it, something that's still meaningful and not totally bland and boring. It does take preparation though. So first of all, investing in the Shabbos meals themselves, either having special food at the Shabbos meal. In my own house, I print lyrics to songs and we sing those songs together, popular Jewish songs, whatever it may be. That is something fun that we do. Preparing interesting questions to discuss at the table, just in terms of not just showing up at the table saying, what are we doing now, and trying to make it fun, but spending a little bit of time on Thursday and Friday, not just preparing the food for Shabbos, but preparing to make sure that the meals are going to be intriguing, interesting, and fun. I definitely think that's an important thing to do. Depending on your comfort level, there are some shuls that are having on Shabbos afternoon women's lectures in person with the rabbis with a mask, stand behind plexiglass with women, socially distanced apart, recognizing the need that women need chizuk, need to be encouraged and inspired as well. It's certainly important to invest in that as well. So it's a very good question. It cannot be completely addressed, but I think the more of these little sparks of excitement that you can invest into your Shabbos with preparation, at least it will be positive and carry us over until this is behind us.
Thank you. And Rabbi Robinson, another question. So we've heard in the presentations today descriptions about how different families, different individuals have different ways of navigating COVID-19 restrictions and different attitudes towards masks and so forth. So a question was asked about mixed messages being sent to kids about safety when they see coordinated outings or school trips. There have been coordinated outings over school breaks, which may not be up to public health guidance. I'm not sure exactly what the question is, but is this a thing that you've encountered, or other presenters, and how to?
Yeah, I mean, this definitely could be an issue. Rabbi Samber addressed that topic before in terms of the concerns of the Agudas, of the unity of the community. I guess a few points I could say to address this. I've been telling my congregation over and over again that the first 4 months of the pandemic, when everyone was doing everything completely exactly the same, people were waving the flag of community unity. It's so beautiful to see the unity of the community. And now people are bemoaning the lack of unity in the community. And I was telling them even then that uniformity is not unity. That's not unity. Unity is actually being different than somebody else, and even potentially completely disagreeing with their position, but being respectful and understanding that I cannot control other people and they sometimes do things different than me. And that it goes in both directions in terms of the finger pointing and the sense of anger, to be honest, that I've sensed from many people in the community. I'm not sharing any of my personal views. My own shul is completely particular about always masking up, always being social distant, and keeping every single guideline that is out there. But that being said, there are elements of the community that are more lenient. I don't think it's my position to represent or be a mouthpiece for them to explain their positions. They are thought out positions, and part of it is related to my presentation before, that for essential needs and for the sake of the spiritual and emotional needs of the youth and of some of these families, perhaps they feel it's okay to be lenient in other areas. Again, I'm not going to justify that, defend that, or get into a debate right now because of that. But over winter break, when they felt there was an entire week out of school and a lot of kids were going to be home completely going bonkers, off the walls, and being very sad and upset about it, outings were arranged that were meant to be held by CDC guidelines. They went to places, the places themselves are particularly at social distancing, and they did the best that they could. Obviously, parents had a choice if they wanted to send there or not. I really only find it to be mixed messaging if your personal leadership is not living up to the standards that they are professing to you. So if you are someone who goes to Ari Crown, everyone knows that Rabbi Samber has been a symbol for that community of how to be responsible when it comes to COVID. If they would see Rabbi Samber himself not living up to his own standards, that would be a mixed message. But we're not new to having different camps and different groups in the community, and educating our children that this is how we do things and that's how they do things. They're following their leadership and we're following our leadership. I don't see it to be a mixed message. If there are people that are being hypocritical or not doing things consistently, that is definitely a bigger question, but I'm not finding that happening too much.
Thank you. Rabbi Samber, in your presentation, you described how you saw even young children expressing a lack of confidence in their parents and their teachers, maybe rabbis, and adults and people in authority. What are some ways that that sense of confidence or trust might be improved, or what are some thoughts about how to build that up in the future?
I think, like all topics of education, it's every interaction from every person plays a part. Every interaction, we have to role model. We have to role model our own sense of personal integrity. Like Rabbi Robinson said, really not just talking the talk, but walking the walk. And we need to demonstrate to our kids our respect for authority. We have to be very careful. And I know that all of us struggle with this on some level. We have to be very careful about how we express to our children our thoughts about questions about some of the authority figures that are popular in our world. So it's not just a question of COVID. It's not just a question of now. I know that one of the things that we talk about when you talk about with children, you know, we all, everybody on this call, we're all a certain age. There's a range, but I think we're all in that age where we grew up and we saw the police as an entity that bespoke respect, authority. Yeah, there may be some bad cops, but we always look to a policeman with a sense of trust. Right? We were told as kids, if you have an issue, go to a policeman. You can always trust the policeman. Today, kids are growing up where because of the media, the police have been demonized, and we have to, every interaction, whether you have a policeman in front of your school, where you have an opportunity to speak in a term of respect for what these people represent. It's every single time that you have that interaction with a child is where you have an opportunity to rebuild some of the damage that's been done. That's really, there's no shortcuts. Rabbi Rosenberg, no shortcut to that one. There's no shortcut to any education with a child. It's one step at a time.
Thank you. Dr. Katz, a question was raised about post-COVID-19 syndrome. Could you address what that is and whether it can be avoided or how best to deal with it? Dr. Katz, you're muted.
Sorry, can you hear me now? Okay, great. So it's well known that after many systemic infections, one can have lingering symptoms and have non-recovery from those illnesses. I personally, this is an area of research and expertise of mine, so I know a lot about it, with symptoms following infectious mononucleosis. But the same thing seems to be happening with COVID. In fact, because of our experience studying non-recovery from mono, we actually were fortunate enough to get a grant to try to study the same phenomenon in the COVID era. There seem to be both biological as well as psychological predictors for non-recovery, and it's really too soon to know what to do with COVID, because obviously it hasn't been around all that long. We're trying so far to use similar approaches that we've done with other illnesses. So, for example, things like graded exercise to try to get people to go back to somehow to their normal activity, reducing stress. If they need any kind of counseling, cognitive behavioral therapy has been shown very nicely to help with chronic fatigue following mono, for example. So there are things that we can do that we're trying to apply to this model. That being said, I am seeing an occasional child who really isn't doing so well, even months after COVID, and we're going to try to address this in a more sophisticated way in the coming months. In terms of prevention, that's what everyone would like to try to get out of some of these data that we're trying to generate now. But we're not quite there yet, unfortunately. I just wanted to say one other thing about the question that was previously responded to by some of the panelists. You know, there is an issue with people not following guidelines, and unfortunately, it's somewhat of an issue in segments of the Orthodox community, as has been hinted at. And aside from the fact that it's terrible when it gets into the media, there also can be some dangers to this. And there are people that we all know who are not going to be convinced of anything, no matter how much you argue. So, you know, I always give this example. At the 40th anniversary of the moon landing, the New York Times did a survey, and 4% of Americans didn't believe we actually landed on the moon, that it was some kind of hoax, that it was in the desert. So when you get that level of disbelief, some people are not going to be convinced by anything, but there are literally now at least a dozen good studies which show the benefit of masking. It's not a personal issue, because by not wearing a mask, you're endangering other people. If you want to make it be a danger to yourself, that's fine. You don't want to wear a seatbelt in a car. That doesn't bother me so much. If you drive drunk, that bothers me because you're going to hit me. So it's the same thing here. We have to be very vigilant in trying to impress upon people how important it is to protect others, I think, in this pandemic. And I think that will help with some of the guidelines, with all respect, of course, to the emotional and social and religious needs of people. And I do think that there's areas to be lenient once people get vaccinated. And I've been telling people that privately, although the CDC has not been so forthcoming in their recommendations, but there are ways to be lenient, I think, when grandparents are vaccinated, for example, when you want to have a Purim Suda or a Seder. So talk to me personally. But for right now, communally, we have to maintain these guidelines because, again, we don't know what's going on with these new variants that much yet. We don't know what's going on yet in terms of only 10 or 20% of the people having the vaccine. Thank you.
Thank you. Rabbi Samber, a question has been asked about how your school, Ari Crown, and other schools are planning for school operations for the upcoming school year. I think this would be of real interest in your own experience and the experience of other schools that you know of.
Wow. You're going to get me starting to think about next school year at this point?
Yes, I am.
Okay, I need to know of the 65 or 70 panelists that are on this, who's going to have availability to work with me for after this call. Okay, I think that right now, the next year is such a question mark, basically revolving around the issue of will our kids be vaccinated? Will they not be vaccinated? Which is Dr. Katz has basically encouraged us to go into next school year with not necessarily expecting that our kids are going to be vaccinated by then. We hope. So we go in, I think the schools are all planning. They'll all have very different models of what will be. Now, thank God our teachers will be vaccinated. So that's going to be a huge piece that we did not have going into the school year. So planning for having our teachers, schools teachers in the building, planning for what we hope will be as close to a regular normal school year as possible. That's where our minds are at right now. Financially and budgetarily, that's a whole other conversation. That schools across the country are working very, very closely about. But when it comes to the academics and the school setting and the school scene, are we going to be still dealing with pods and social distancing and face masks? We hope not, but the chances are that it's a very strong possibility that we will be. But we're a lot wiser, and we've been around the block once now, and going into this school year, I think schools everywhere are just feeling a lot more confident that we will be able to roll with it. And have a product of a school, of an educational product for our children that's on par with a regular school year.
Thank you very much. A question was asked about a vaccine. So this is directed at Dr. Katz. We would like to see as many people take the vaccine as possible. I think that's a universal view here. And once a large number of people have been vaccinated, the question that's raised is, if the rules are not relaxed after some percentage of the populace is vaccinated, do we not run the danger of an unintended consequence of that policy that fewer people will vaccinate? In other words, if people don't see that
yeah, for sure. Yeah, no, so I agree. There's going to be other unintended consequences too if we don't relax the rules. So just quickly, public health guidelines are very conservative and move a little bit slowly, unfortunately. The CDC has relaxed some things already, right? They've already said that if you're fully, and we've told this to our schools and your teachers, that if you're fully vaccinated and you have an exposure for at least 3 months, you don't have to quarantine, right? So that's already something in the rules that are being relaxed. I saw something in the New York Times the other day about how nursing homes and other assisted living facilities are starting to open up again because basically everybody who's residing there has been vaccinated. So, and I think, again, it's a little too soon to start opening things up. Sorry, the phone will stop ringing in a second. So it's a little too soon to start opening and to start having maskless minyanim, in my opinion. But I think the rules will start to relax. I think that traveling will open up, and many things will open up once more of the community is vaccinated. And I agree with you. You don't want to be I don't want to be in a position where I'm defending public health rules that don't make any sense, and when I'm somehow defending rules that I don't think are actually correct.
Thank you. There have been so many wonderful questions. I'm sure there's so many more, and our discussion will continue beyond the scope of this forum. If I could just add a word before handing the baton back to Tamara. All of our presenters have described I don't think you've used so much the word empathy, but there's the tremendous amount of heart has been used, I know. Tremendous amount of heart and concern for people and the whole community of thousands and thousands of people trying to cope with a very, very difficult experience. Dr. Katz has referred to we a number of times. Dr. Katz, you've said, we have done this, we have done that. And I understand by the use of we, you're referring to a group of medical professionals and other people who have worked together to support synagogues and schools and other communal organizations in trying to navigate this. So I know that you're part of a much bigger team, and the concern that you and all of your colleagues have, and all of us here, has helped bring us through a very, very difficult time, and hopefully we're seeing some light at the end of the tunnel. So I'm going to pass the baton back on to Tamara.
Thank you so much to each of our presenters, Mrs. Fran Gutstein, Dr. Ben Katz, Rabbi Yaakov Robinson, and Rabbi Eli Samber. We are so fortunate to have each of you in our community, and so fortunate to have each of the sponsoring agencies available for support. Before you leave, please fill out the survey that has been shared in the chat. And thank you all for spending your morning with us.